Glycogen storage diseases. So firstly there is the GSD, and this is the type 0, and the enzyme deficiency is the glucogen synthase. Symptoms, it can include the hypoglycemia as well as early death. Next we are looking at the GSD type 1A, and this defect is known as the von Gerkel's disease, and this goes on to the deficiency of the glucose 6 phosphatase. And other thing to note is that the symptoms, it can include the hepatomegaly. There is also presence of the renomegaly, and this is due to the glycogen accumulation. There is also severe type of fasting. Severe fasting. There is hypoglycemia. There is also growth failure. There is lactic acidosis, as well as the hyperuricemia and the hyperlipidemia. Next, moving on, there's GSD type 1B. In terms of GSD type 1B, there is presence of the enzyme deficiency of endoplasmic reticulum, glucose 6 phosphate transporter, and in here what is seen is the symptoms, it is same as the von Gerkel's disease, same as that. And there is also recurrent infections. This is due to the impaired neutrophil function that is present. Next we are looking at the GSD. This is type 2. Now here the GSD type 2 is also known as the Pompey's disease. And after this, the glycogen storage in the Pompey's disease is the lysosomal alpha 1, 4 and 1 and 6 glucosidase. There is the acid maltase. Now what is the deficiency? See, the Pompey's disease was the deficiency of lysosomal alpha 1, 4, 1, 6 glucosidase acid maltase. Now next we are going to look at what are the symptoms. Symptoms of the Pompey's disease, it includes the presence of muscle weakness. There is also death, this is by 2 age, as well as there is cardiomegaly and heart failure. Now we are looking at GSD type 3. Type 3 is nothing but the Cory's, or it is also known as the Forbes disease. So what does this Cory's or Forbes does is it limits the dextrinosis, and this is nothing but the glycogen debranching enzyme. Okay, and now looking at the symptoms, it includes the muscle weakness as well as the fasting, hypoglycemia. There is also the hepatomegaly. This is due to the accumulation of the branch chain of the polysaccharide, as well as there is a limit dextrins. There is growth retardation, as well as there is normal uric acid, as well as normal lactate levels.